What will be the global implications, especially for the African continent, of the withdrawal of moratorium on aid from the United States through USAID and other organizations?
The cuts are very big, so the impact is going to be huge. And it's going to hit very many different areas. So I'm going to focus just for a minute on the ones I know best, which are the impact on health and on the rights of women and girls there. So there are a lot of health budgets in Africa that are very dependent on US money. For some countries, 60% of their health budget comes from aid. So they're not going to be able to fill that gap. It is just impossible, whatever people say. So what are we going to see? We're going to see HIV infections come back up. We're going to see HIV becoming more resistant to the treatments that we have. We're going to see tuberculosis coming back up. We're going to see the collapse of vaccination programs, of immunization. So we'll see epidemics of vaccine preventable diseases coming back. And we're going to see also an increase of maternal deaths, of unwanted pregnancies, because there won't be contraception accessible. So you can imagine the enormous impact, an impact that doesn't make any one of us safe. So the impact won't be contained in Africa. We're going to see, as a result, more HIV in other parts of the world, more epidemics in other parts of the world. And it's also destroying trust. It's destroying the possibility to collaborate, to work together, to really have an impact on both global health and on women's rights. You know, again, like it was a long time ago, being pregnant, having a baby, mothers are going to risk their lives again doing that because there will be no services.
Which sectors are more at risk, and how will this situation affect women, as you said, and their access to basic health services?
Look, of the basic health services, everything is affected. A lot of healthcare workers, a lot of commodities, you know, the products that get to have to be in those clinics, they get there because of programs that used to be funded by USAID. And the data even that you need to be able to plan and to get those services to people came from WHO, UNAIDS, organizations that were also getting US funding to do this. So the whole system is very dependent to get these products to the people. And we always know that in crisis situation, and as I've said, this is a big crisis, it is women and girls, it is those from excluded communities that suffer the most. So I was saying, you know, women will bear the brunt of this, and it will make us all less safe.
Could the lack of adequate protection for women, whether health services or shelter services, lead to the result or the rise of unregulated clinics, informal practitioners, or fraudulent missionaries?
All of that can happen. But if you ask me, my guess is while all of that can happen, the gap that's being created will be filled by disease and by death. So let's not worry too much about what else is going to fill the gap, because primarily what we're going to see is an increase in, as I said, unwanted pregnancies, increase of STIs, increase in violence, and probably increase in migration as well. And also, let's not just think this is limited to Africa. I've just come from discussions here in Skopje, and you know, we're seeing the impact here already as well in communities.
You said you are in North Macedonia now. This year, the national budget has cut funding for HIV protection and medication. What is the global trend in budgeting for HIV-related programs?
So we've had for decades now an increase in funding. When you looked at the global picture, a significant increase, and we need to thank donors, private sector, national governments, local governments as well for that increase. And as a result, we've seen the epidemic in most places go down, the deaths go down. Now that is going to be reversed because, like we've seen here, other countries are also cutting. And it's particularly sad, angering that we're doing this at a time when we've just got new prevention technologies, new injections that will stop the epidemic in its tracks, that we could really break the back of the epidemic. And just as we have that coming out, the funding goes backwards, and then we're going to see the epidemic come back. It really is a disaster.
One of the most affected regions is Palestine. What is your role there and the support that you provide in this part of the world?
Well, IPPF works in every country with national organizations. So there is one organization, Planned Parenthood Federation of Palestine, that is working there. Its clinic got flattened by bombs on the 8th of October. However, the healthcare workers that were there, the midwives, the nurses, the doctors, have continued, even as they themselves had to be displaced. Some of them died. We lost some staff. They have continued providing services in what can't be defined in any other way, that war crimes targeting healthcare workers and aid workers. So they have suffered a lot, but the services, as much as they can in heroic conditions, are continuing, and we're very proud to continue to support them. I think it is a question on all of our humanity that we allow that to continue.
What are the biggest challenges faced by young people, and I mean by the age of under 25, considering that your organization also focuses on youth?
Our organization works a lot with young people, and we're seeing not just cuts in funding for young people, but also, if you want, a reaction or a division between those who, I think every parent wants the best for their children. But some people think that you can achieve that by informing them, by making sure that they learn, for example, about how to interact with other people, how to relate to them. They learn about relations, they learn about sexuality. Others think it's best to keep them ignorant and in the dark and to fill their head of fear. That science has been very clear. That doesn't work. What happens is that they learn through social media and through porn the worst side of sexual relations, and that if we bring that into schools, if we connect it to services, and if they have hope that they can find jobs, that's by far the better reality. It is a very difficult time for young people right now, and we've seen since COVID sort of how that is affecting their mental health. I'm very happy to have just come from seeing a pioneering service here in Skopje provided by HERA, which is providing mental health support for young men. That is pretty new, and we've seen there's an enormous demand for that.
One of the challenges that young people face in the country is the lack of reproductive and sexual health problems or measures. How can this be actually addressed?
Well, it is realizing that if we want to keep safe, and I think everybody wants to keep young people safe, then we need to educate them. We need to help them access the right information at the right age-appropriate information. And we need help of schools and teachers to do that. So youth peer education has a role, but also the school curriculum needs to educate in this. Keeping them in the dark, keeping them ignorant does not work. We need to make a conscious effort to educate.
What is your view on the influence of the church in certain societies, including ours? How can modern societies resist pressure to ban abortion or remove sexual education?
Look, I'm myself personally respectful of all religious beliefs. What I find really difficult to understand is the obsession with imposing my own religious beliefs on other people who do not share them. You know, I don't think there is anybody who is arguing to, if you do not believe that an abortion is right, nobody's going to force you to have an abortion. Equally, if I think that I need an abortion and that is the best thing for me, why does the state or some person with different religious beliefs have to impose that on me? I think we need to respect religious beliefs, but also the church needs to respect that not everybody shares those, and that some decisions like abortion are a private decision between a woman or a couple and the doctor. It's not for the state to force anybody to carry to term a pregnancy that they don't want.
What has been your experience working in countries with far-right governments or under the influences of such political ideologies globally?
Look, IPPF, we work in 149 countries. We have governments of every color, of every tendency. We have governments that are very supportive. We have governments that are very restrictive. But we're able to work in most governments, because in most countries, in nearly all countries, because people understand that women and girls need services. We're even able to work in some of the most challenging governments, places like Afghanistan, for example, or places with far-right governments. We also need to understand that women will seek services, including abortion services, whether they are legal or not. Banning some services doesn't stop them from happening. It just makes them more unsafe. If you understand that, and many governments understand that, then you can find a way of collaborating, of providing services in a way that's respectful.
Can the influence of Trump-era policies, both in the US and globally, be breached or reversed? If so, how?
We're seeing huge impact everywhere. I've just come back from, hearing how shelters for LGBTQI people have closed here in Skopje, how legal aid has been terminated because cuts of USAID funding. Can that be reversed? I think it can be reversed. It can be reversed through global solidarity, but I think we've got a lot of work to do to go back to the communities, help communities organize, and in a way we've got to win the street again. So people's hearts and minds needs to be won again, so people understand that it's through collaboration, through solidarity, that we will be free, and that for me to be free, the other people have to be free again. If we understand that, I think we will overturn some of these things that the far right, in this case from the US, is trying to impose on us.
Thank you for this interview.
Thank you. Thank you, Maria. Really appreciate it.